Welcome to the Children's Healthcare Canada Annual Award Ceremony. My name is Emily Grunwald and I am the CEO of Children's Healthcare Canada. You've heard me say it before, but I'm going to say it again. This is one of my favorite events every single year. This year is made a little bit more special by a special friend who I have with me today. His name is Xander Zatilny.
Thanks, Emily. That's me. Hi, I'm Xander Zatilny. I'm 12 years old and I was born in Montreal, Canada with a rare heart condition called truncosarteriosis. But that hasn't stopped me from being a normal kid and playing multiple competitive sports and having my own podcast where I interview famous celebrities from around the world to help bring awareness to my charity, which is the local children's hospital. My latest interview was Mitch Garber, who actually donated $1,000 to CHEO in my name in the interview.
That's awesome. What Xander didn't share explicitly, but is probably pretty obvious, as he's a pretty avid hockey fan himself. He's still pretty young though, so let's give him a bit of grace before he learns to cheer for a good hockey team.
Good hockey? You're wearing a Sens jersey and you're chirping me about good hockey? Okay, let's be honest. Both of our teams have some work to do, but the season is still young.
You're right. It could be worse. We could be cheering for the Maple Leafs. Not only does Xander cheer for the Canadians, he also plays hockey too. In fact, you might say Xander is a true super fan. A little bit later, we're going to share a special project that Xander is up to support Canada's Children's Hospital in collaboration with the NHL. This kid means business.
Speaking of business, let's go on to the business of the day, celebrating the heroes who care for kids like me all across Canada. Emily tells me that the Children's Healthcare Canada Awards program has been recognizing leaders in children's health since 2005. There are 4 awards: Patient and Family Leadership, Award for Individual Leadership, Award for Leadership in Media, and Award for Organizational Leadership.
It's a mouthful. We also use this opportunity to acknowledge leaders who make our conference possible. Our 2021 conference co-host this year is the team at Children's Hospital London Health Sciences Centre. London, we know you're out there. You have the largest delegation of leaders at this event. Again, your team has been absolutely amazing to work with. We have been working with your hospital leaders for almost a year now and have learned so much about the incredible programs and services you have to offer children, youth, and families in Southwestern Ontario. As a small token of our appreciation, we sent a gift to your team earlier this month. We'd like to share this with our audience now.
Thank you, London. honor to announce the first award of the evening, the Children's Healthcare Canada Award for Patient and Family Leadership. This award was created to recognize outstanding leadership by a parent or caregiver who has served in a volunteer capacity to improve the patient and family experience for those accessing children's health care in Canada. I know firsthand how important it was for me to have my parents by my side and to have them advocating for the best care possible for me, but also for the other kids like me. Our winner tonight received numerous nominations. I will now pass the mic over to one of those individuals, Allison Martins, to describe why she nominated our winner, Rachel Martins, for the Patient and Family Leadership Award.
Hi, I'm Allie Martins, and I nominated Rachel Martins for the Children's Healthcare Canada Parent Partner Leadership Award because of all of her meaningful contributions to the conversation that happens nationally and internationally about children's healthcare here in Canada. And I thought that her efforts need to be highlighted and celebrated and recognized. And I also think that as a mom of a kid with special needs, I feel like likely this past year has been harder on her than most, and I wanted to hopefully share an opportunity for her to feel loved and cared for in a big way.
I would like to thank everyone for the honor of receiving the 2021 Children's Healthcare Canada Award for Patient and Family Leadership. Words can't fully express how I feel in this moment of recognition. The reason I took an interest in child health reminds me of something that happened to me during the start of the current school year. I was talking to a mom friend who was filled with a lot of self-doubt, wondering if given her circumstances, she was making the right choice for her child. Sometimes with those darker challenges, we need an opportunity to lean on others and in order, honestly, to find our strength. And she talked, I listened, and we sat in that dark spot together until she was confident enough to keep moving. After that conversation, I thought that this might be a good time to take this message to Facebook and Twitter. And as honestly, I figured a lot of people needed that reminder. And just to say these words aloud this time of year, I just want to remind you that you are a great parent, and that's all. I lost count of how many comments and messages I got from parents who were in tears, feeling like they needed to just hear these words from somebody. We all just want to do right by our kids, and that comes with as well an investment in their health. For my family, our healthcare relationships were a complicated network. And honestly, I'm a big fan of the dance analogy when it comes to care. At times, we danced with great frequency with healthcare providers, learning these steps together. And then there were times where we kind of collectively lacked the confidence to keep moving, but we did so together with the best evidence we had on hand. Though my spouse and I knew that our time with our son was going to be a short period with him, he passed away in 2020. And for as much as I battled with grief and heartache, I knew as well that this was never going to be done in isolation. His healthcare team felt that loss too. And they helped us buy some more time with our young man as well. And they cheered him on as he learned how to dance as well on his own. The day my son passed away, my spouse looked at me and said, "We did good." And for as much as that statement shook me, I stand in his statement with confidence and say to you collectively, and likely to some here who were also as part of his healthcare team, we did good. But if there's one thing I know about healthcare, it's that it's never linear in its accomplishments. There's never a collective endpoint where we get to shout, "Hooray, we've accomplished and solved all of the things." We are forever learning and growing as a science and as a practice. And I look forward to a future where we continue to have really hard conversations between patients and families and healthcare providers. I hope that we will continue to look within ourselves with honesty and seek collaboration with others in an action as effortless and without hesitation as breathing. As I am so thankful for this continued opportunity that I have to take what I learned in 14 years of making a second home in pediatrics and helping new voices gain the strength and knowledge to find their seat at the table. The term stakeholders in research kind of has a way of getting dulled with frequent use, but at its root is another word for investment. While our healthcare stories may be diverse, our invested energy to create change merely needs to be pointed in the right direction. Author Glennon Doyle spoke once about an excited fan approaching her at a speaking engagement. She hands her a handful of crochet flowers and says that in order to channel her nervous feelings, to meet her favorite author, she needed to keep her hands busy. Glennon goes on to say that all experiences are an energy that can be used to fuel positive efforts or change, that we can make the challenging moments that we have in life and create beauty. I take that story with me as I work through processing my own life and finding meaning. Now, honestly, it's a time where we can take all of the trauma and the frustration and the joy and grief and memories and the whole bundle of experiences that come with a global pandemic and use that to fuel a new vision for healthcare for the future together. Let's consider how we can collectively create something beautiful. People like my family recognize the year that hospitals have had. And frankly, if I could somehow time travel my way through med school with lightning speed, I'd be scrubbing in and giving a hand where I could. Until time travel is attainable, in your strength and in your weaker moments, patients and families are ready to help build back better where we can. This year has given me more drive and to make a dent in the universe than I ever knew I was capable of. I'm energized by the memory of my son and those in healthcare who have made an impact in my life. Let's take the coming year as an opportunity to show strength and learn together as well. Thank you again for this incredible recognition.
Thank you so much, Ali, and congratulations again, Rachel. I have had the honor of getting to know Rachel over the past 2 years, especially through the Children's Healthcare Canada Family Network, through the Inspiring Healthy Futures Initiative, and of course, through our nonstop social media banter. Our next award is the Children's Healthcare Canada Award for Individual Leadership. It was created to recognize outstanding leadership by an individual who has dedicated his or her career to improving the health and well-being of children and youth in Canada through health promotion, policy, and/or increased public awareness. Dr. Stephen Miller is the head of the Division of Neurology at the Centre for Brain and Mental Health at Sick Kids Hospital. He's a professor of pediatrics at the University of Toronto and a senior scientist at the Neuroscience and Mental Health Program at the Research Institute of Sick Kids. He also holds the Bloorview Children's Hospital Foundation Chair in Pediatric Neuroscience and previously was a Canada Research Chair in Neonatal Neuroscience. If that wasn't enough, Stephen is also the scientific co-director and the principal investigator at ChildBright. With a CV like that, it's no wonder Dr. Miller's nomination stood out. Congratulations, Stephen.
I'm honored to be here today to express my gratitude for this recognition from Children's Healthcare Canada. Thank you for recognizing the infant brain and its lifelong impact on children, families, and society. I am especially grateful for this recognition at a time when our focus is from crisis to catalyst, the next chapter for children's healthcare. Let me speak briefly about crisis. Mental health issues are bringing children, youth, and families to hospitals in record numbers. Now, in part, this speaks to the success of reducing stigma, and we should continue to encourage help-seeking behavior. But this also should inspire us to act individually as healthcare providers, researchers, and educators, and collectively as a society to transform how we support the mental health of our children. In my opinion, this is the most pressing challenge in child and adult health. Now let's turn to Catalyst. Our brains, billions of neurons making trillions of connections, make us who we are. We've known for a long time that a healthy brain, starting in babies, is foundational for lifelong mental health. But we know far less about how our experiences influence the neuromechanisms that support optimal mental health. Without this knowledge, we are limited in our ability to develop more effective mental health interventions. Thankfully, neuroscience is beginning to shed light on the intricate connections between brain, environment, and experience, revealing new targets for therapies and new ways of thinking about supporting mental health altogether. So what are we discovering and how will it change care? A baby's brain at 35 weeks gestation weighs only 2/3 of what it will weigh at term, only 5 weeks later. This surge in development makes newborns uniquely vulnerable to injury and uniquely capable of resilience and recovery. With our interdisciplinary research team, we are learning about the importance of the everyday experience of critically ill babies. Things like pain, nutrition, mechanical ventilation on the brain. We are now identifying opportunities to provide intensive care in ways that promote optimal brain development. I want to acknowledge my colleagues in the neonatal neurocritical care program at Sick Kids, who are bringing research advances to the point of care every day and closing the gap between what we know and what we do. For all of us here at the Children's Healthcare Canada meeting, our emerging evidence suggests we need to think beyond the walls of our hospitals in promoting brain and mental health. How can we support our patients and their families in closing the gaps created by social inequities? It's a call to action for all of us. And I believe all of us includes children, youth, and families. As a co-lead of ChildBright, an innovative pan-Canadian patient-oriented research network that aims to improve outcomes for children with brain-based developmental disabilities, I see firsthand how authentic patient and family engagement makes research more impactful. And I believe all of us also includes the young people, the aspiring clinicians and researchers listening today. To them, I wish to say, there has never been a better time to focus your energy, passion, and talent on supporting the developing brain. This era of unprecedented opportunity for science discovery to improve child health is dependent on you. And as a community, we must support this pipeline of young child health investigators to ensure that this era continues. Now, being a mentor and watching my trainees flourish has been a joy of my own career. I want to thank them for all they are doing to improve child health. With their advances, I am confident that our future is even brighter. I want to close with a few more notes of gratitude. At Sick Kids, I'm privileged to lead the Gary Hurwitz Center for Brain and Mental Health. We are inspired by the vision that every child deserves a healthy start, a strong mind, and a bright future. I want to thank my Sick Kids family for all they have taught me and shared so generously these past 9 years as we strive for a brighter future for our children. And I want to conclude in thanking my family. My wife, Dr. Mina Matsuda Abedini, a pediatric nephrologist who teaches me every day what it means to be a caring physician. And my children, Hannah and Sam, who with Mina inspire the best in me. Children are 25% of our population and 100% of our future. Thank you, Children's Healthcare Canada, for making our future brighter.
The Children's Healthcare Canada Award for Leadership in Media was created to recognize outstanding journalism, reporting, editorial, or blogging that increases awareness of child health issues. This award is especially inspiring for me as an aspiring podcast host. In fact, it's a little bit insulting I didn't get nominated. Maybe my nomination just got lost? Yeah, that must be it. Just kidding. The recipient of this year's Award for Leadership in Media is Harold Gagne. Mr. Gagne was nominated by Saint-Justin in Montreal. For several decades now, Mr. Gagne has worked to educate the public about priorities within children's healthcare. Mr. Gagne is especially passionate about organ donation for children, the importance of research on cancer and rare diseases, of vaccine including COVID, and concerns of a looming shortage of healthcare providers. Welcome, Mr. Harold Gagne. Thank you for your efforts on behalf of Canada's children.
Bonjour, mon nom est Harold Gagné, TVA Montréal. My name is Harold Gagné, TVA Montréal. I'm very happy to receive this award. Thank you very much. Je suis très heureux de ce prix parce que la santé des enfants, c'est ce qu'il y a de plus important. The children's health is very important. Depuis plusieurs années, je fais beaucoup de reportages ici à l'hôpital Sainte-Justine avec des enfants malades, des enfants que la science réussit à sauver. For many years, I have done many reports here at Sainte-Justine Hospital.
Depuis l'âge de 4 mois, Théo faisait jusqu'à 100 crises d'épilepsie par jour à cause d'une maladie génétique, la sclérose tubéreuse de Bourneville.
C'est les crises typiques de Théo. Ah oui. Il va flasher des yeux.
En juillet dernier, le docteur Alexanderville et son équipe lui ont installé 67 électrodes sur et dans le cerveau afin de déterminer avec précision les zones où il y a des décharges électriques.
Donc, c'est les électrodes qu'on va mettre sur le cerveau.
Puis, pendant une semaine, Théo a été hospitalisé et branché à un appareil qui a recueilli des données. Convaincu qu'une nouvelle intervention chirurgicale allait permettre de diminuer les crises d'épilepsie, le Dr Veil a demandé aux parents s'ils étaient prêts à courir un grand risque. La région qui contrôle sa motricité pouvait être touchée.
J'ai aussi fait des reportages en soins palliatifs au phare enfants et familles à Montréal. J'ai même accompagné un jeune dans la mort.
À la maison de soins palliatifs pédiatriques, le phare enfants et familles dans le quartier Rosemont à Montréal, nous avons été témoins de grandes histoires d'amour et nous avons eu le privilège d'accompagner William, ce garçon de 9 ans, dans ses derniers moments de vie. Ses parents ont appris en janvier 2017 qu'il était atteint d'une tumeur inopérable au cerveau.
J'étais dévastée, j'arrivais pas à y croire. Je comprenais pas pourquoi c'est à nous que ça arrivait parce que William, il allait tellement bien avant, tu sais. Puis je comprenais pas, j'étais triste, en colère.
Il a subi 30 traitements de chimiothérapie qui lui ont donné de l'énergie pendant quelques mois, lui permettant de réaliser ses rêves de rencontrer ses idoles du Canadien et de la télévision. J'ai aussi fait de nombreux reportages écrits pour le magazine Sélection du Reader Digest sur Liam, greffé du cœur. L'article a même été traduit en anglais. Sur Liana, l'enfant miracle qui n'avait que 20% de chances de survie. Elle ne pourrait pas atteindre l'âge de 2 ans. Le don d'organes est à mon avis très important. Eliane vient d'avoir 1 an. Depuis sa naissance, il a de graves problèmes cardiaques.
Il avait un bloc cardiaque congénital, donc on est seul à la 19e semaine de grossesse.
En avril dernier, ses parents ont appris la mauvaise nouvelle. Il a absolument besoin d'un nouveau cœur pour continuer à vivre.
Tu ne veux pas entendre ces mots-là, que ton enfant va être transplanté cardiaque. Lui est en phase terminale cardiaque, mon enfant.
L'attente peut être longue, jusqu'à 1 an, avant de trouver un donneur décédé. En attendant, pour l'aider, les médecins lui ont implanté un cœur de Berlin. La COVID et l'isolement des jeunes enfants ont aussi provoqué de très nombreux virus respiratoires. Il y a quelques jours, nous nous sommes rendus aux soins intensifs de l'hôpital de Montréal pour enfants. Ce petit bébé de 2 mois lutte depuis 2 semaines contre une bronchiolite causée par le virus respiratoire syncytial.
Il avait commencé à couler du nez, puis 3 jours après, il a commencé à être blanc, mou. Il n'y avait plus de tonus, fait que j'ai consulté à l'urgence de Val-d'Or. Puis après 3 jours, son état, il se dégradait, fait qu'on a été transféré ici à Montréal au Children.
On a 1, 2, 3, 4, 5.
L'infirmière-chef fait le décompte. Dans la majorité des lits des soins intensifs, il y a un nourrisson atteint d'un virus respiratoire.
C'est quelque chose du jamais vu.
Avec la pandémie de COVID-19 et les importantes mesures sanitaires, les bébés et leurs mamans n'ont pas été exposés progressivement à ces virus, comme le sont habituellement 90% des enfants avant l'âge de 2 ans.
Un jour, grâce à la science, probablement que plusieurs de ces jeunes vont réaliser leurs rêves.
Mathis revient avec sa mère au pavillon Charles-Bruno du CHU Sainte-Justine pour rencontrer son oncologue.
Oui, je peux examiner ton ventre.
Mathis avait 3 ans et demi quand un premier cancer a été diagnostiqué. Il était de stade 4.
C'est une tumeur qu'on appelle une tumeur de Wilms ou un néphroblastome. C'est une tumeur du rein. Tout ça ici est la tumeur. Le radiologiste l'a mesuré à presque 15 cm.
L'opération et les traitements ont tout fait disparaître, mais 1 an et demi plus tard, un autre cancer est apparu.
Le nodule qui est apparu est ici. Ça, c'était pas normal d'avoir ce nodule-là dans le poumon.
Pour combattre son trouble anxieux, il a commencé à jouer de la batterie à 6 ans.
Je fais la batterie, mon instrument principal, le ukulélé, le clavier, la basse, la guitare et la voix.
Il a consacré la pandémie à composer et à partager sa musique sur les réseaux sociaux pour diminuer le stress.
Encore une fois, merci énormément pour ce prix. Thank you very much. Et merci aussi pour votre dévouement. Thank you for your devotion. Harold Gagné, TVA Nouvelles, Montréal.
Our next award, the Children's Healthcare Canada Award for Organizational Leadership, recognizes the leadership of an organization, a foundation, or a corporation that enables the best healthcare for Canada's children and youth. The recipient organization has demonstrated leadership to inspire change and innovation that has had a significant and lasting impact on the pediatric healthcare systems and/or the populations they serve. This award also recognizes the value an organization places on partnerships and collaboration within healthcare. When I joined Children's Healthcare Canada in 2017, I have to admit, I had not heard of the Safe Haven Project for Community Living. Sander, what does Safe Haven mean to you?
Safe Haven is me in my bedroom with my headphones on listening to music.
Awesome. You got it. By definition, a safe haven is a place of refuge and security. Did you know that for over 25 years, longer than you've been around, the Safe Haven Project for Community Living has been providing exceptional care to children with developmental disabilities and complex care needs. Safe Haven, as we call them, may not be big, but they sure are mighty. Respite and residential services are provided to over 200 families each year. Beyond residential care, Safe Haven is working to create integrated, community-based care by expanding affordable housing options for youth and young adults with complex care needs. In collaboration with hospitals, Safe Haven will design a transitional care model for children leaving hospitals and moving into residential care that supports them from childhood to adulthood towards independent living. This eliminates barriers between pediatric and adult healthcare and bridges gaps in essential supports lost in adulthood. This innovation is possible through strategic partnerships with healthcare leaders such as Holland Bloorview Kids Rehabilitation Hospital and Sick Kids Hospital, a feat recognized by Accreditation Canada in awarding Safe Haven accreditation with commendation. Please join me in congratulating the Safe Haven team.
In March of 2020, when the news came, our organization went into high speed immediately. We actually had to put our respite program on hold.
The clients living in the congregate care settings, of course, they were unable to see family members.
I did see a lot of families start to unravel. Parents just couldn't care for their children anymore. It was taxing on them, it was taxing on the family.
So what we really saw was agencies that were at risk, staff were at risk, their clients were at risk.
There wasn't that supportive, registered, regulated healthcare professionals available to the sector in their sites. And we were very unique in that we did have registered and regulated professionals at Safe Haven.
But for us, it was important to respond and be a part of the system solution during a very difficult time. We would not have been successful in the education program if we had not pivoted very quickly to the virtual environment.
So we did receive that funding from the ministry to build a program. I worked with, at the time, an educator. The entire program was created within a matter of a week, but not without the help of our partners in the community.
I've always been somebody who reaches out to people. So we really did dig deep into that. And we partnered with infection control departments. We partnered with public health. And I think the product was something that we could really stand behind. And it was interesting then when we start looking at some of the people who were joining in the sessions. There was people from all over the province.
The leadership here at Safe Haven is awesome in terms of their ability to kind of be forward thinking and always looking for an opportunity to be able to support and kind of go beyond the walls of Safe Haven.
We were hit very, very hard in wave one. You know, at that time we had 8 simultaneous outbreaks, and the people that we would support were absolutely in incredible harm's way. And I remember speaking to Susan Bissillon. She just said, "Enough, Sandy. You need help and you need, you know, expertise." And I just remember she says, "You'll be able to sleep at night," which of course was not happening at that time. At a time of immense stress and pressure, most organizations close in, because it's just too much. You're just trying to manage your day-to-day. What I was so impressed about was Safe Haven turned out and said, no, we have some experience and expertise. Let's try to innovate. Let's try to figure out solutions so that all of us are safer.
Like, I felt we had a resource. I felt we could really help. I felt that we could have an impact. And we were making a great impact in the developmental services sector. But then, when the ministry called, said, could you help other sectors like the violence against women, the youth justice, the young infant and parent? We said, yes, we can help.
Clients that we do serve at the shelters, our number one priority is their safety, and their confidentiality is quite linked to their safety. They often did not feel comfortable going out into the community in order to get their vaccine. So having that on-site vaccine support was quite helpful.
These families who had to run from abusive relationships, and then we get in to give them education and vaccines, and they had no clothes. They had no clothes. So then we're doing like food drives and clothes drives.
Having to have an added burden of having to take these clients out to a mass immunization clinic or a doctor's office or a pharmacy to either be, get a swab done or to get a COVID vaccine or a flu vaccine would have added just that much more.
They had, in a way that they wouldn't at other clinics, an opportunity to sit and relax, to lie down, and to be in the care of the people at Safe Haven who knew what they were doing when it came to vaccinating neurodivergent and disabled patients. I do hope they feel that their experience with the medical system was a fair one, was a human one, was one that made them feel cared about.
Had a partnership with Sick Kids put in place where if there were any children that came in and their entire family had contracted COVID, we would be a support facility. We actually had a baby come to us. He was 3 weeks old, and mom and dad and the brother, they all got COVID. Letting them know, you get better, we're taking care of your baby.
How do you think innovatively? How do you look at the research and the evidence and what exists now? And then how do you take that to the next level? For me, it's been incredible to be able to think in that way.
We consider ourselves innovators and leaders. So when we look to our partners, we expect the same, we look for the same. Sometimes you have to be really creative, really innovative to be able to see beyond what many might think are barriers that are insurmountable.
The fact that we've partnered with them for so long, and it has been a very rewarding partnership both ways. I think we learn as much from them as they perhaps do from us.
I think Safe Haven has lived out what they talk about in being change makers and advocates and partners in the community. When you have a vision and a mission that drives what you are about in caring for clients and staff, then that, I think, pushes you and pushes others in different ways to carve out new pathways.
People felt like they were safe. So I think being a part of it was such an amazing experience.
Never doubt the impact of a committed team. When I look at the strength of everything that happened here, it was an amazing experience. It was tiring. It was tough. I feel very determined now to things that I probably would have held back on before. That no, we're gonna keep pushing. It's about coming together and really looking at what's within the art of the possible.
Many of you also know I'm the Executive Director of the Pediatric Chairs of Canada. Earlier this month, we had the opportunity to recognize 6 outstanding leaders in academic child health. Dr. Mary Connolly from the University of British Columbia received the Clinician Practitioner Award. Dr. Angela Punnett from the University of Toronto received the Clinician Educator Award. Dr. Terry Clausen from the University of Manitoba received the Clinician Investigator Award. Congratulations also to 3 emerging leaders. Dr. Frederick Dallaire from Sherbrooke, Dr. Melanie Morris from the University of Manitoba, and congratulations as well to Dr. Manish Sandarangani from UBC. Xander, it's not hard to imagine that one day you're going to be here on our stage accepting an award of your own. Why don't you tell our audience about some of the incredible work you're doing with our children's hospitals?
I'm working with NHL teams and children's hospitals across Canada to bring awareness to children's health. I visit each city where I interview professional hockey players and hospital leaders on my podcast. This helps bring awareness to the children's hospitals on their foundations.
Pretty amazing.
Hi, I'm Xander. I'm 12 years old from Ottawa. I was born with a rare heart malformation called truncus arteriosus. Over this NHL season, I will be traveling across Canada to visit all 7 Canadian teams to help bring awareness to their local children's hospital and their foundations. We will be interviewing heroes both on and off the ice.
Sort of kept busy, putting a very good baseball team, and at that young of an age, you always
enjoy what we do to support the hospital. They're opening up veins and all these sorts of things. And then join me on my tour to help highlight children's health and to help kids just like me.
It's always a bit awkward when your co-host outshines you, isn't it? Especially when they're 12 years old. I'm just joking. Xander, you're a pretty incredible kid, and I can't wait to follow your journey across this country as you interview some of our favorite hockey heroes. It's been a pleasure working with you, and I hope we stay in touch over the months and years to come. Friends, I hope you enjoyed this virtual edition of our annual awards ceremony. I know you will agree it would have been incredible to celebrate these leaders in person, and I promise you, next year in Vancouver, we will celebrate so big, we will make up for lost time. Until then, I hope you can enjoy me for a non-alcoholic, age-appropriate cheers to our 2021 award winners. Thank you for your commitment to Canada's kids.
You don't drink them.